Thank you to everyone who joined us. This is actually the first in this financial year of our series of eGov dialogues. These are sessions, webinars or hybrid, where we try to bring together partners and speakers who are working on topics and in areas that are relevant to e-governance, to data governance, to basically the various domains along which eGov is also working. For today, we are thrilled to be joined by Aparna Krishnan, who is Project Director and Advisor at JPAL South Asia. We've been speaking with Aparna and her team for, I think, close to 2 years now. And so we've learned a lot from the information that they've shared around how they work with governments in India and beyond on making data more usable, more accessible, at the same time, how we can put in place frameworks so that when researchers work with governments and use that data, it's being done in a way that is safe and responsible. And we're looking forward to hear more on those frameworks, as well as probably some examples of how that's played out from Aparna in the course of today's meeting. We're also delighted to have Beni Chugh from Dwara Research, where she leads the Future of Finance initiative, which has been doing really interesting, innovative, really cutting edge work on understanding access to finance for people in India and beyond. The research I've most recently read and been familiar with is looking at access to benefits transfers or financial inclusion in India. Again, we've been speaking for a while around this idea of what kind of systems, what kind of data, what kind of procedures, what kind of safeguards are necessary for various aspects of service delivery and benefits transfer. And so again, looking forward to hearing more about that today. For those not familiar with me, my name is Ameya Naik. I lead the Policy Analysis and Research team at eGov Foundation. And so my team looks at our engagements with academic institutions, think tanks, research partners. We also incubate to some extent the monitoring, evaluation, and learning and the privacy and data protection portfolios within eGov. My colleague Brinda is also with us on this call, who works closely with me on the data protection and privacy work. So what we're planning for today is that I'll start us off. I'll then hand over to Aparna and then to Beni in that order. We'll take ballpark 15 to 20 minutes each. We plan to talk about different aspects of both the governance from the privacy point of view, but also usability, quality, actually ensuring that the intended use takes place with respect to data in the context of governments and administrative agencies. We'll then do a brief panel discussion, maybe about 15, 20 minutes. I'll have a couple of questions for them. We'll then open out to the audience for another 15 or 20 minutes. And then probably we'll take 5 minutes towards the end for concluding remarks. Ballpark, we aim to get through this between now and 5:45. With that, let me get started. So what I'm hoping to talk about today in the next about 15 or 20 minutes is some ideas around data and privacy in government service delivery. And in the course of the slides, I'll also touch on why this is relevant to eGov and the work that we do. The starting point for this conversation is pretty much the question of what, if any, legal requirements are there around access and use of data, especially personally identifiable information, data which, if it was in the possession of a person, could enable them to know things about me or about you, about the people to whom that data pertains. Occasionally you will hear people say that, we're waiting for a data protection bill to be brought in India, and so there isn't necessarily already some sort of legal system in place around PII and data protection and privacy in India. And as a starting point, I think we want to strenuously argue otherwise, that there is in fact prevailing law in India that dictates what is necessary to do with respect to personally identifiable information, that there is in fact prevailing law with respect to privacy and data protection. The direct source of that law right now are the judgments of the Supreme Court in the Puttaswamy judgments. So initially in the Puttaswamy 1 judgment, and then as further elaborated on in the Puttaswamy 2 or the Aadhaar judgment. Condensing what those judgments say, they basically say that there are 4 criteria that have to be followed in order for a government entity or some other entity to access data, including PII of an individual, and for the law to say that there is no breach of privacy in that case. So I am not currently talking about the context of access to data with consent. That's an entire separate area that has its own research and its own debates, and we're going to park that to the side for the time being, right? I'm talking about what does the law in India say is necessary if a government agency wants to access the data of a particular individual. Okay, and it says that there are 4 tests that have to be satisfied. The first is that there has to be a legal basis for that access, which is to say there has to be an actual law that says this entity is in fact allowed to and empowered to access that kind of data. There is a great deal of debate again around what exactly constitutes a valid legal basis. But for the time being, let's just say there has to actually be an enacted law that says this. There may be some fuzziness and variations around that, but by and large, that's a bright line rule. There has to be an enacted law. The second is that there has to be a legitimate purpose, right? Which is that it's one thing to say that this agency has potentially got the mandate or the power. But even if they have the mandate or the power, they have to say the reason that I'm asking to see this particular data is that there is a certain function that I have to perform, and to perform this function, I need this data, right? They cannot simply say, because I have the mandate, I want to scan this data every week just because I feel like it, right? The third is that the data that is collected and viewed has to be proportionate, which is to say, for the particular function or mandate that is to be performed, that agency should be collecting only and viewing and using and storing and processing only the bare minimum amount of data that they need to perform that function. Right? If it is possible to do that task with only 2 or 3 fields of data, they should not be collecting, storing, processing, using, etc., 7 or 8 fields of data. So the way that the court has articulated the idea of proportionality is use the least intrusive method. Again, in the context of administrative data, this comes down to how many fields of data do you collect, how many fields of data do you use. And finally, and we're going to loop back to this probably towards the end of my session as well as in the Q&A, there is the idea of there should be adequate safeguards, which is to say that if the previous 3 measures are being followed or not, there have to be mechanisms in place to actually test and make sure whether that's happening. In addition, in the context of digital systems, and if we talk about data privacy in the context of e-governance, there is also a necessary prerequisite around the side of cybersecurity. So you need to have reasonably secure systems to ensure that there is no unauthorized access. And you need to have safeguards to make sure that all of these procedures are being followed. So with that as the background, now speaking for a bit about who we are and what we do, right? At eGov Foundation, we are a nonprofit that works on creating open source software as well as working with markets and governments to see this software implemented and leveraged to drive changes in how people are able to interact with their governments, how they're able to receive services, the efficiency of all of these things. And so we work across multiple thematic areas. The 4 broad areas that we work on right now are urban governance, sanitation or waste management, public finance management, and some aspects of public health, particularly around health campaigns management and preventive health and disease surveillance. All of this is towards the goal, as it says on the left side, of accelerating the achievement of the Sustainable Development Goals in 30 countries by 2030. That's the current target we're aiming for. If we have this conversation in 2030, probably you'll see an even bigger and more ambitious number there. But what's common across all of these is that these are all domains in which individuals interact with government in the context of requesting or receiving certain services, possibly also making certain payments such as property taxes, fees, service payments, etc. So software that we use to do this, let me just pull all of this up. The software that we use to power this is called the Digit platform, which you can think of as a number of microservices or software building blocks that can be composed, recomposed, assembled to meet a number of different use cases, not unlike how Android is structured. For the purposes of today's conversation, there's two things I should highlight on this slide. The first is that we use registries as structures in which, or as microservices in which data is stored and from which it can be accessed. The second is that in some sense, across the black lines that you're seeing between the layers on this screen should be dotted lines called APIs, because access to or communication between these services, including registries, is through APIs. This will be important when I talk about our approach to data privacy and governance in the next couple of slides. So just to give you all a snapshot also of what are the different kinds of things that can be done in the Digit platform, just because this will help imagine the kind of data that we say we're handling, right? So there's a bunch of things around which people basically make payments to their local government. There's a bunch of things around receiving various kinds of permissions, certificates, no objection certificates, approvals, licenses, etc. There's a bunch of things around actually applying for specific services like water or sewerage, or filing a public grievance for something that you want corrected. And then there are some, so to say, backend modules around account management, accounting, finance, etc., as well as websites, dashboards, mobile applications. So here's what actually happens in the context of especially Digit Urban. In the context of an urban local body, when a citizen is requesting a particular service, they will actually make that request to the ULB or administering authority, and in the process, share some kind of data. In most cases, it's not like the person who is sitting in the office in the urban local body is going to get up from their desk and go to the person's house and deliver a service to them. This is usually going to be done by some kind of frontline worker. So in turn, the urban local body or the administering authority or the service providing authority is going to share some kind of data with the frontline worker. That frontline worker may be employed by the government. They may also be contractors. This varies from city to city and state to state. It's that frontline worker who's going to deliver the service. They may receive some feedback from the citizen. They in turn will report back to the ULB on the work that was done. This again can take various forms from city to city. In some places, they might have to upload photographs. In others, it's just a take or a call in. They may raise, if they're contractors especially, they may raise bills to the administering authority and they may in turn receive payments. The administering authority in turn may be sharing information with the citizen, either on the status of a particular request or complaint, or about any proposed service, or for that matter, demands for certain fees or taxes, anything that they want paid. So we think of this as a triangular model, right? The individual, the citizen, the resident makes certain requests of the city authority or the urban local body that they are living in. Some of that data is necessarily shared with the frontline worker who has to deliver the service. And then there's a flow back of feedback, other information, status tracking information. This might flow a little differently if you think about the collection of taxes or fees, where the demand is generated by the city, the citizen is making a payment. Again, there may be a frontline collector who's involved, who is privy to certain information, who's collecting that money, who's issuing receipts. With this as the background, my core sort of 2 or 3 slides, right? What does the fourfold test look like in the context of service delivery by local government? Legitimacy or legal basis in that sense typically comes from the act that creates the ULB itself, the urban local body or the other service providing authority. Right now, this is pretty much the 74th Amendment to the Constitution, and their list of functions is in the 12th schedule. So those are the things that an urban local body is mandated to do, is empowered to do. And they have a legal basis for engaging with citizens and trying to do those things. The legitimate aim or the legitimate purpose pretty much flows from the same, which is that the urban local body has a mandate to provide these services, right? They have a mandate to provide solid waste management, they have a mandate to provide sewage. In some places, they have a mandate to provide water. In other cases, that may be another agency, but whoever that agency is will still need information about the houses and the places to be served. So the legal basis and the legitimate aim and legitimate purpose are somewhat bundled together. This should not be particularly controversial, at least for that set of services that we agree a city is mandated to provide. Maybe if some city is trying to do something new and innovative, there might need to be another discussion there. For the most part, this is quite straightforward. Proportionality is a little more interesting, because proportionality requires the application of mind to say, what data is really required to provide this service, right? What is the cost benefit on collecting this data? What is the cost benefit on storing this data? This is not a purely academic discussion, right? This is a discussion that very much involves citizens. It involves frontline workers. It does involve people talking about what do they feel comfortable sharing? Do they find it more convenient to share something once, or are they okay with sharing it again and again? And this is not an area that necessarily has one clear correct answer either. Though I should say there are some clearly wrong answers. It is possible to say that there's some information that you almost certainly don't need to provide a particular service. If somebody is complaining about a street lamp in their area not working, presumably the only information you need is the location of the street lamp and not much else. But if somebody is asking for a connection or a cleaning or something at their house, then you might need some additional information as well. In both of those cases, you might not, in the first instance, need to know the gender of the person who's making the request, right? So this is a more involved conversation. And finally, there is the question of what are the safeguards, right? So we've said that there is a legitimate purpose. We've said that, okay, the ULB has to provide this information. But what systems are in place to make sure that only the minimal data is collected? What systems are in place to ensure that it is stored for the time that it's needed, used for the purpose that it's been collected for, possibly deleted thereafter? What systems are in place to make sure that it is not shared beyond that intended recipient or set of recipients? So again, there's nothing wrong if somebody was to deliver a service at a particular place, ask for the address of that particular place. But beyond that frontline worker or maybe one person in that chain of authority, if a third party is also asking for that address, that's something we really have to think about and say, who is this? Why are they asking for this? Does it make sense for them to have this? Again, as I mentioned, in the context of digital systems, there is also a prerequisite of appropriate security measures in place. If your system is very easy to breach, then whatever procedural safeguards you may have on the front end, as it were, it's not stopping people from hacking in and taking that information as they want, right? So we've tried to apply these four principles to the Digit platform and to how we do our work. And we sort of developed both draft privacy policies for ourselves as well as for implementing agencies and partners. This is stuff that I had originally hoped to actually share links to on this webinar. It's still a bit work in progress, but I am hopeful for sharing it within the coming month or so. And so probably when we put up the recording of this webinar, we'll be able to share it with these links as well. My last but one slide, right? Just to summarize what I presented so far. As a going in position, we believe that there is a legitimate purpose being served by service providers getting access to certain data. It's necessary for them to deliver services. We also believe that citizens do share many of these data points with pretty much the same implicit understanding, right? You might in fact need to put down a formal notice, but even if you didn't, people have a fairly good intuitive understanding of what information they're sharing, why it's necessary. In fact, this is a conversation we can have on the panel or in the Q&A. People's like cultural expectations around what information can be shared can vary from place to place and can be more permissive or more strict from one place to the next. Be that as it may, people do have a certain expectation that this information will be used to deliver the following service to me, and also that it will be kept safe. It will not be misused. It will not be allowed to be shared widely with people otherwise. And finally, if we think about the scale at which administrative data gets collected and aggregated in India, and this is particularly a point around the use of digital systems to do this, right? It's not that, for instance, property information was not available with the property registrar or the local government already. But when it was kept on paper, and when searching through the records required physically flipping through pages and pages, there was a degree of friction that was inherent in the medium. When you have digital records, the fact is that this data is being aggregated in ways that are easier to compare, compile, search, mine, etc. And so it's not just the data collection end, it's also at the point where different people are able to perform different operations on the data. There are a lot of thought and a lot of attention is needed in the design to make sure that the appropriate safeguards and the proportionality are being maintained. And so this is my last slide. What we do in terms of safeguards today, right? Of course, on the security end, there are appropriate security measures in place. Our program teams do have fairly involved conversations around data minimization, right? So when something is being implemented, one of those conversations that will happen not just once, twice, thrice, multiple times with the government authorities or with the client is precisely, what is this data point? Why do you need this? Yes, we understand that this is visible in your reports today, but that's not a, that's not a mandatory function for us. That's a suggestion. Let's think about what this is and why you use it and why you need it. And if you don't need it, frankly, let's not collect it, right? We have what we call role-based access controls. RBAC is the acronym, which basically says that what information a particular individual in the government is able to access is determined by their role. So this is the feature that in some sense operationalizes the idea of legitimate purpose and proportionality, right? Who are you? What is your job? What information do you need to do your job? Okay, it's fair for you to get that information. We are working on making it so that even for people who have access to that information, it appears masked. And if they have the permissions, then they can unmask it. But what this does is that this creates a log of who has asked for something to be unmasked. In the future, it will be possible to either add a consent loop to that unmasking and or to make those unmasking requests in themselves auditable, viewable, adding an extra layer of protection and safeguards. More generally, there are indelible logs and there is an auditable trail of any action that has been done in the workflow. So what we're thinking about now is, as I said, one is how to bring in consent loops. Where does it make sense? We're really thinking hard about, you might have heard people talk about like frictionless search or seamless integration. We're sort of revisiting that question and saying, okay, maybe there actually should be some seams, right? Maybe we actually do want to insert some friction in this process, at least depending on who the person is that's trying to integrate or search. And so that's an ongoing conversation. And then a little bit further out, which is why I've got it down on the side and in another color, is this question of whether data gets deleted at some defined time. And whether there is, the GDPR in Europe talks about a right to be forgotten. Even the draft versions of the law in India have not really gone that far. But it's worth thinking about. It's worth thinking about. In fact, the latest draft of the data protection bill had this interesting idea around the right to nominate a person who would sort of be the survivor and trustee of your data after your death. And so it's worth thinking about what are the circumstances under which we think data can actually be deleted or somehow transformed to be smaller, less identifying, and how can that be done as well. So that's what I've got for today. I do want to come back to the safeguards question later, but for now, let me hand over to Aparna. Aparna, if I did a brief intro, but if there's more that you want to add on the intro before you dive into the slides, please go for it. I'm going to stop sharing, so you can also pull up slides if you want.
Thanks, Amaya. I'm really happy to be on this forum. As Amaya said, I've been engaged and been tracking eGov's journey on thinking through data safeguards and data use. So it's really good to see this conversation continue and also, I think, adding value with every round of these discussions. So I will be speaking today from the perspective of research use of data. So as Amaya mentioned, I work at the Jameel Poverty Action Lab, South Asia, JPAL South Asia, and we've been engaging extensively with governments and nonprofit organizations in undertaking impact evaluations of large development programs. And we use a methodology of randomized controlled trials to undertake this research. And so fundamental to a lot of our work is the use of primary data as well as existing sources of secondary data, administrative data, and other new forms of data. And so to sum up this conversation around safe use of data, the trade-off in a sense between more data, granular data, and privacy and protection of sensitive data, there is a little bit of that trade-off because there is more potential with the kinds of digitized data that's becoming available. But are there legislation, are there safeguards in place, and how does research deal with some of these concerns? And so there are practices of institutional review boards, which do the ethics review, which govern consent, which govern data storage as well as deletion in research contexts. Some of these lessons could be applicable, could be replicable to the debates around service provision and digitization of services, as well as management of large administrative data within governments and non-government organizations. So that's the perspective that I hope to bring today. I'll also go through a few slides that I have to start off the discussion, and then happy to engage further. Give me a minute to share. Okay, assume this is working okay, Amaya? Okay.
Yes, we can see this.
Thank you. So just a quick context on JPAL so you understand the perspective that we bring to the topic we're discussing today. It's almost taking off from where Amaya ended, right? He said, what do we need for provision of services? And what the kind of research that we undertake is to say, can we ensure that these services are being delivered by governments most efficiently and most effectively? And so that is the questions we're trying to answer, is to say, where are the gaps in delivery of services? What can be done to improve the effectiveness? Because we work in low resource settings. So what is the best use of existing government public resources? And ultimately, what is the most cost-effective means of improving welfare of citizens? What improves livelihoods, earning potential, and overall social welfare? And so the research that we undertake typically answers these questions. We engage with governments and nonprofit organizations to identify what these challenges are. We co-create innovations and try new things that address some of these challenges. And we undertake impact evaluations jointly to assess the impact of these new innovations that are being tried. A part of our work is also policy outreach and scale-ups, which is to say, what have we learned from the research? What have we learned from these pilots? And how can successful interventions be implemented at scale? So we also provide dissemination and technical advisory support to our partners to scale up the most effective interventions. And the third vertical of what we do is central to all of our work is to build capacity within the ecosystem, within our public as well as non-government partners, to encourage better and more meaningful use of data and research in decisions. So as I've alluded to in the beginning, The infrastructure that we have at JPAL relies a lot on primary data collection. So we have large field teams that collect data from individuals and households as needed to address specific research questions. But we've also increasingly over the last few years tried to explore the potential of using existing administrative data with governments, private providers, and NGOs, and to see how that can complement either unpacking a problem that we're trying to solve, or in measuring specific outcomes at as granular level as possible, and also to understand the challenges that are peculiar to local context. So our approach is essentially trying to combine global expertise in research and in economic and development theory with a strong and deep understanding of local context. And that's why we have this globally informed and locally grounded approach to undertaking research. And it also explains the view to data. It's not data in of itself, but it is the purpose for which data is being used ultimately. What are the questions that we're trying to answer? And then look for the most appropriate and the most reliable and meaningful data that helps us answer those questions. So our approach to thinking about data starts with the problems or the policy challenges that we're trying to address. This is a graphic that I think Amaya has seen me use over the last few years now, but it still holds. It's essentially saying we've seen tremendous growth in digitization, in advanced statistical and technology mechanisms for collection, storage, and sharing of data. But we haven't seen as much growth in the use of data for decision making. And what do I mean by that? We have many platforms like Digit that have made the process of delivering local government services much faster and easier. However, there is also the promise of using such data for better planning, for better monitoring, for better innovations, and what can we do more to address populations that are being left behind. So while it may serve the immediate administrative purpose, the larger potential is how do we use that for better allocation of resources? And there are many constraints to that problem. Some of it is the fact that mere digitization doesn't improve data reliability. It could be the case that unique identifiers are not collected. It could be the case that there are no field checks in place, which means that you don't have any sense of whether the data that we've collected is actually accurate or not. In other instances, it could be collected but not made accessible in manners that enable analysis. So PDF forms, images don't really help with analyzing data, although I think techniques are catching up now for other forms of data as well. But it makes it much more difficult. Some of this friction may be necessary, as Amaya said, but from a perspective of data analysis and use from within government or for research, it makes it that much harder to be able to make sense of the data and to be able to solve some of the challenges we're trying to address. In other instances, you could have good systems in place, but limited capacity within data providers and largely thinking about governments to make sense of data, right? So going from, say, 13 or 14 registers that an Anganwadi worker is filling out on a daily basis to suddenly entering forms on a mobile app. The block level officer or a district level officer is now suddenly flooded with a lot of data, right? And if you haven't paid attention to what data do we need, how should we collect it, what are the indicators to group and analyze the data, we just have millions and millions of data points that we don't know how to make sense of. So while designing systems, it is also important to think about what is the use of data, what are the different levels. So it is not always data going from the ground level to the state or government of India level. It is how do we make data accessible and usable at every level, from the frontline worker to block district officials, state officials, department heads, and further on. And so that's sort of the second piece to say is brings about this change in mindset of data as a tool for decision making. And ultimately, the third box that we often talk about is, from these insights, what are some actionable points that jump out at us? Can we connect two seemingly unrelated data sets, for example, that look at nutrition levels as well as, say, sanitation in an area? Because as we are increasingly seeing from behavioral economics, the interventions or the nudges that may be needed for a certain behavior change could come from a completely unrelated sector. So in order to improve, and I'll give you an example of this, but let's say in order to improve farmer adoption of technology, It may not be as much training and dissemination of knowledge, but perhaps providing a small incentive, or it could be working through farmer collectives. So the solutions could be governance, solutions could be coming from other sectors to solve the problem. And that's when we really start working with the power of data for planning, and what is and building in foresight into delivery of services. And so what this requires, and I'm not going to go into this in detail because I'll take you through an example, is embedding meaningful use of data and safe use of data at every stage of the decision life cycle, which is routine reviews that tell you what the challenges are, deep dive analysis and diagnostics of the existing data, as well as the local context to understand the problems, designing innovations, and ultimately scaling them up. And so each of these require different types of data. Each of these require different systems. And this is the motivation for me to get to the point that it's not a one solution that's going to work in all cases, but keeping in mind all of these various data use purposes, which then will feed into what are the data mechanisms that we need to have. Right? So in some cases, we will, for instance, for improving data reliability and usability, could be pretty standard techniques. We can borrow much of this from research, which involves field data audits, guidelines and protocols to collecting good data, documenting what data is available. Oftentimes, even directorates or departments within a government will not know what data is being collected. And often that's the first starting point, is saying, are 3 people collecting the same data field in 3 different ways? Are there efficiencies there? Could we standardize what we use to capture a village or a hamlet? Basic first order standards. The next point is on developing indicators, and this starts talking to the data use purpose. If you're interested in nutritional outcomes, is it stunting, wasting? What measures do we use for decision making, and therefore ensuring that the data is collected both for the numerator, which is number of children, but also the denominator, which often gets missed out. Because when you're delivering a service, you only capture data on people who are coming to the health center or people who are coming to the government center. What about those who are further away or who are marginalized and don't enter the government system? So we need to have clarity on who the data is capturing and who is getting. And so some of it, not everything will come from administrative data, but if we were to say combine a survey data set with admin data, we should be able to predict who is in a data set or not. So combining a national family health survey, for example, with the administrative data at a district level, will be able to tell you whether it's fairly representative of the population or not. And then finally, what are the kinds of solutions that we can actually determine? Could we look at, say, cell phone data or satellite data to identify poverty indicators? There's a lot of recent research that's happening in this area. Could we look at non-traditional data sources to target interventions? We see a lot of direct benefit transfers, which I think Beni is going to talk about soon as well, that use both traditional and non-traditional data sources to target the people who are in most need of the service or in most need of the subsidy. So it's moving from the point of, is the government able to deliver cash subsidies, to is it delivering it to the right people? And are we actually identifying who should not be getting it as well and reducing the gaming that happens? So that sort of gives you a context of how research comes at these questions. And so when we start thinking about how is data useful to answer some of these questions, I'll take you through 3 enabling features. The first part, which we think always helps to demonstrate the use of data as well as the systems and safeguards that need to be in place, is to anchor it in the purpose of the use of data. So demonstration projects can go a long way to help showcase, to help explain and put in place systems and processes within governments, within nonprofit organizations on how to collect, maintain, store, and share data. So research collaborations can often help some of these silos in which data is collected. So we are, as I mentioned earlier, multiple people collect the same data, or sometimes multiple people collect very different types of data, which otherwise may not be speaking to each other. But bringing one common question can help actually throw up challenges or throw up ideas. And so the example I'm going to give you is of a frontline worker-led service delivery on immunization. And this was a research study that was done in Haryana at scale between 2016 to 18 that looked at using the existing reproductive and child health data and the HMIS system. So this is, for example, an instance, for example, where 2 systems don't actually speak to each other. The reproductive and child health data is collected at the individual level. whereas the HMIS data is collected at the area level. So one of the common things we have is we have two different measures of what the full immunization rates are in an area because they don't exactly capture for the same population. There are ways to solve it, of course, but somebody has to ask this question on actually trying to connect both of those data sets. So in the context of this experiment, while immunization rates at the country and at the state level have shown remarkable improvement over the last 2 decades, especially with improvement in supply of vaccines and fixing vaccination dates, there are parts in Haryana within districts sometimes and some districts which are severely lagging behind on immunizations for children. Especially you see the drop off for the measles vaccine, which comes at the 9th month. It's 6 months after the most recent vaccine, so people tend to forget. There isn't as much hesitancy across the country as we have learned to see in the case of COVID and in other instances in other countries. In India, we often are led to believe, or by doing surveys with people, a lot of the times it is because it's expensive. You have to take a day off from work. You have to go and get your child immunized. You don't know whether the nurse will be there. It may take the whole day, right? So it needs small nudges to help to remind people and to improve the rates. And so we tried a new idea, which was to say, can we map out social networks in a village? And we did that because we had 2 interventions in mind. The researchers and the paper is published, and there's a link with the slides, which we can share with you later, and you can look at it. One of it was to say, if you come to the immunization center with your child and you get the scheduled immunization, you get a talk time recharge of say 50 rupees, or you could get 100 rupees. With every increasing immunization, you get a slightly higher amount. That's the small nudge, which is to tell people, to remind them and to show up and make it worth their while and not postpone the decision. And the second one was just targeted reminders. Your child is due for the next vaccination, which is what all governments do and have been doing for many years. But does that really have an impact on bringing children to the site? And that's another intervention we tested. And the third one was actually using social networks, which is to say, if we were to seed the message on the value of immunization and the importance of immunization with information nodes in a community. So these could be trusted people like a sarpanch or like a school teacher, or it could just be an information hub, or what is called in network theory as a gossip, the person who spreads information. So we did a survey that just asked people, who do you get information from about the local mela in the village or about government schemes? And so people would identify sometimes just their neighbor, an aunt, sometimes a tailor, it could be anybody. Right. And so the intervention actually used these data sources. The first part, an MIS was developed, and this was before the RCH app was developed in Haryana, as part of the experiment, an MIS was developed for frontline workers to deliver immunization services and capture information about children. We found that, parents would tend to forget the immunization card at home. So there was we had to develop a QR code system that captured information and made it easy for frontline workers to adapt the app and use it. The second was then through the survey, we had identified these network nodes. And so they got messages about the value of immunization. And so a combination of all of these things were tested out. So through RCT style, we had multiple interventions that tried only incentives with information, incentives, reminders, and information, and combinations of these. Now, it was important for us to check that the data being collected through the MI system, it took about a year or 2 to just develop that system, but also that the data collected by frontline workers is reliable. So there was an independent data team that actually captured, for a subsample of the information, the immunization outcomes of the children being reached through the frontline workers. Ultimately, and I won't go too much into the impact of the program because I want to talk a little bit about the data journey. It was this combination of using small incentives along with gossips. Interestingly, the trusted nodes did nothing to improve immunization rates relative to the control. It was actually just these information hubs, as we call them, people whose job it is to spread information, along with the text reminders that had close to 50% increase in number of vaccinations relative to the control group where it was business as usual. Right. So now all of this study is an example of how we've used administrative data from what the frontline workers collect with a very novel survey data trying to map social networks and also validating that data. And to our, I would say, partly surprised, but also we were really gratified to see that the data collected by the frontline workers was very good quality. So when we did the data validation and you compared data sets, very few errors in place. But it also happened because there was extensive training over a period of a year for the frontline workers, making the app usable, a helpline number where they could call and report problems and was immediately fixed, and the server infrastructure in the backend, which meant that the data flow was seamless. Data protection measures were in place, especially because this was sensitive information, personal information being collected about children and parents. It was all, of course, through the app that frontline workers were using, but the backend infrastructure needed to be robust. And then ultimately, this helped us look at techniques of machine learning to actually determine which policy response is the most efficient. So out of all of these things tested, there were about 70 different policy options that were possible. And then we had to look at prune the data to see what would actually be the most cost effective, what would give us the most bang for the buck if the government had to scale it up. And now the government is actually trying to scale this up within the health system. And they're doing a policy pilot in about 3 districts, which we hope over time will help inform decisions with other state governments. And so the way word on the institutional measures that needed to be in place, we have a long-term MOU with the government of Haryana, as we do with every collaboration with governments. Data use agreements that go into details of who will access the data, how it will be shared, to what extent, for how long. IRB approvals, which do the ethics review for all of the research, as well as routine audits and reviews of the project and data. So that's just to give you an example of what could cause, I would say, an instance that helps thinking about the systems in place. And as you can see now, the health department actually has a number of different ideas on how they could use the HMIS data and RCH data better themselves. And it sort of built the use proposition for looking at data for planning purposes and to see what else they could do better. The second part of our data strategy, I would say, is making sure that there is capacity within governments. Data is currently nobody's job. And so there needs to be systematic efforts, which is distinct from tech. There's tendency to combine tech and data functions, and while they're related, these are slightly different roles. And so there is need for somebody's or a team's job, which is to actually look at the quality of data and the usability of data that is being collected. We are engaged in a new partnership with data.org to look at this in the climate and health space particularly, and I can talk about this later, which is to look at how training data science professionals specifically for social impact and placing them on projects with government and non-government partners to work on such projects, which could help open up data for research and data for decision making. And finally, there's been a lot of conversation as the legislation emerges around the data policy, both at national levels and state levels. We've been engaged in a couple of instances, at least with state governments, thinking about a data use policy, right? And this is, I'd like to make the distinction between a data sharing policy from an open data policy, from privacy legislations, which Ameya just talked about. There are AI and ethics policies, which are different. These are all related and they all have to be developed together. But distinct from all of this, what is needed is also a data policy that can guide why we're collecting data, who needs to use it, and how it can be shared and with whom it can be shared, right? And both within government and with outside of the government. And so just a quick things to consider. I'll talk about what we use in research called the 5 SAFEs framework, which help us target these questions. These are safe projects where you check for appropriateness. There's a little bit of what Ameya talked about earlier is why do we need the research? What does it help solve? In research, the reviews help do that. Policy reviews also help do that. Is this answering an important question? Safe people, identifying who can access. Is it institutional affiliation? So, you have to be affiliated to a university usually to access data. You assess conflict of interest. Safe settings, which is the physical environment in which the data is being shared. Sometimes it is on site. Sometimes it's a separate server, which does not have any other information on it. Sometimes it's not networked. Working out all of those protocols in detail is needed. Safe data, which is how do you minimize the risk of inadvertent disclosure. And so there are a number of statistical and analytical methods that are available for protection of data that can be used. And ultimately safe outputs, which is that when you publish, even if at the aggregate level, sometimes it may be possible to work backwards and identify the personal information. And so ensuring that in publication as well, there is no risk of identifying personal information or sensitive information. And so there are again statistical methods for the same. And DUAs and agreements can also talk about the due process to be followed before publication. And so this is a starting point. There are many measures that are similar to this, but it helps as a framework to think about it. There is a handbook on using administrative data that we've published at JPAL, which talks about relevant for this session, for example, balancing privacy and data usability, model data use agreements. And there are a number of case studies from around the world which talk about how these measures have been put in place. And so this is completely available for free online and can be used by anyone. So let me wrap up there by saying that the solution is often a combination of legal, technical, and institutional measures that have to be developed together. Oftentimes we have one and the others are missing, and that's where we run into a lot of challenges. We also have to keep in mind very different types of users that need different solutions. So within government is different from research use, is different from commercial use, is different from open data for accountability purposes. And finally, we need policies to be combined with clear implementation guidelines and data use. Sorry, I went a little over, Ameya, but let me stop there.
No worries. I think that was fascinating as well. Let me then quickly tag in Beni. Do you want to share your slides? Do you like us to share them?
Yeah. While I do that, Amina, can I get a quick time check? What do you think is a good estimation?
We are at 4:55. It is ideal if you stop at 5:10, but 5:15 is still good.
Yeah, I'll try my best. Okay. Is my screen visible?
Yep.
Yeah, and it's on slideshow.
Yes.
Great. Thanks, Amaya. Thanks, Aparna. The reason I'm slightly confident that I'll be able to wrap this by 5:15 is because you all have already covered so much ground that there's very little for me to say except maybe +1 most things. So just in terms of what I'm going to cover today is Amaya has covered one side of the provocation as to why we need safeguards for data protection and privacy in government systems. And that's mostly coming from the fact that there is a legal framework which recognizes people's right to data protection privacy, and it needs to be upheld. I'm going to kind of show the second side of the story, which is that citizens themselves are very particular about privacy and they have strong preferences about what they want to share or not with local government. We have some data that I'll quickly want to kind of take you through. Then the next kind of portion of my talk is going to be relatively short, given that both Aparna and Amaya have kind of come at it from different tangents, which is to say that why are governments increasingly kind of getting immersed in personal data? What is causing governments to collect or generate more and more personal data? And what does it mean for the citizen really? And the short answer is something that kind of Amaya alluded to at the beginning, that what it means is that sure, social protection can be made more robust by the availability of personal data. But what that means is that we need proportionate, robust safeguards. And we look into the question of what do safeguards look like a little bit now, but mostly also in our panel discussion. So that's the scope of our talk today, my next 12 minutes. I'm Beni, Chugh. I head the Future of Finance Initiative at Dwara Research. At Dwara Research, we look at the issues that low-income customers or low-income citizens face at the last mile, especially in the rapidly digitizing kind of context of retail digital financial services and social protection delivery. So we are not privacy experts, we're not data protection experts, but what our work over the last 5 years has told us in the context of social protection is that misuse of personal data, inability to safeguard personal data, or even just plain simple issues in data quality can cause exclusion from social protection services, say direct benefit transfers, right? Time and again, we hear that people's Aadhaar card details don't match other kind of ID proofs, and then they're left out of, the safety net of, let's say, benefits or Manrega transfers, so on and so forth. And that's how we came at, when governments use data, what is the kind of safeguard, what is the environment in which that data needs to be processed, collected, stored, etc. And that's really my vantage point. So it's kind of a bit of what Aparna kind of alluded to, which is to say that we need all kinds of levers, legal, technical, operational capacity And we've tried to kind of condense all of that, what would good data protection practices look like for the government. And I'm kind of going to give you a small overview of it towards the end of my conversation. I have done too much ado to say without much ado, but I'll just dive in. So I want to say that back in 2020, this was just before the COVID lockdown hit us. We undertook a study in Dwara Research, which was about understanding low-income users' preference of sharing personal data. And we had a bunch of data types to say, are people comfortable sharing financial information, ID information, demographic information, health information with several counterparties, for instance, financial service providers, local governments, etc. So I'm showing a small sample of the evidence which relates to local government, just for the kind of context we are in. And this is what we found in the study, that when it comes to sharing personal information, people are very selective, right? So this is perceptions about sharing of ID proofs based on gender. And when we ask people what was their comfort level of sharing, let's say, ration card information with local government, then there's a bar in the center, roughly in the center, the black line. The left of the black line is actually the nays, where people are not willing to share information, and the right-hand side is the ayes, where people are willing to share information, and there are different reasons, right? And this goes back to the core of how we define privacy, which is to say that people behave differently with different counterparties in relation to different information types. So if I complete the example of ration card, then about 18% of men said that they would not share information, either because they were worried that it might lead to harm, or because they thought that that information was personal. For women, the number was slightly higher at about 22%. What I want to kind of belabor here is the distinction between the reds and the ambers. The reds are not sharing information for the fear of harm. The ambers are not sharing information because the inherent feeling that it's private or personal, right? So a lot of times we hear that people don't share information because they're worried that it'll cause them harm, but actually people have an innate sense of privacy, right? So when they're not sharing information, it's not the fear of harm as much as it is the expectation that this is my personal information. And I kind of have the advantage of having gone through the data multiple times and in different settings. So I kind of know. You'll just have to take my word for it until this work gets public. But what we have found when we really look under the hood in these trends is that there is an inherent sense of purpose limitation, right? Which is to say that, why would my government need this information of me, right? Or why would a financial service provider need this information? So when we kind of followed up with, please excuse the background noise, but when we kind of followed up with questions to say, why aren't you comfortable sharing this? They're like, no, the government doesn't need to know this information. So this is just an ID proofs, but I want to take you to a slightly more interesting data point, which is health information, right? Here we say that the reticence to share information is quite high, and mostly because it's private or personal, right? So 44% men say that they would not share health reports with, let's say, local governments. Again, I think a distinction needs to be made between local government and central government, but 44% of men say that they wouldn't share health reports, while 57% women thought that it was extremely personal for them to share it with the government. So that's the context in which we're operating. So there's one side, which is the legal framework, but I just wanted to bring the citizen story to the board to say that that legal framework is very much grounded in people's privacy expectations. Another interesting kind of observation is that as I move from ID to health to financial, as the nature of data itself gets more sensitive, the nays kind of increase, right? The unwillingness to share also increases. So this is just to kind of give you 2 cents on, people out there worry about privacy, have inherent privacy preferences, and when given a platform, they express them quite clearly. And therefore, what does that mean for governments? Does that mean that governments don't collect data? Why are governments collecting so much data when there is so much unwillingness from people's point of view? A quick story, actually, and both Aparna and Ameya have done a fantastic job, but really what we are seeing is there is a digitization of social protection that is happening. I speak to the context of social protection, but I think it's broadly applicable to governance as a whole. But there is a digitization of social protection which is happening, which kind of means that more and more of our conversations, transactions, interactions with the government are getting digitized. They're creating more and more digital footprint. They're getting stored. As Amaya said, they're getting aggregated. Previously, we enjoyed an obscurity, a security by obscurity, because it was all paper-based. It was hard to kind of put all the papers together. If you were lucky, you would actually have a file. If you weren't, you'd probably be dealing with lost papers, right? But now every person has a dedicated memory bank. All the information against that person is getting stacked in that memory bank. And why is that happening? That's happening because I think there's an increasing realization that digital social protection can be more nimble. And what I mean by that is that digital social protection can real-time interpret data as to what is happening in the world and adjust or recalibrate benefits accordingly. One example is COVID, right? At the time of COVID, when we realized that just the BPL criteria would not suffice, and we need people who are just above the poverty line but equally vulnerable, so that we can kind of reach out to them and provide social protection benefits. The task was huge, not only on the fiscal side of things. I can't speak to the fiscal side of things. I'm sure it was a challenge to kind of put that money together. But the immediate challenge was also to say, how do we identify those people? Because we don't know. Right now, the lists that governments have are not as robust or not as kind of tight to say, is everybody documented? Is everybody identified? And what are their parameters? What is their age? What is their income? What is their geographical location? And the need to kind of get all of these data points is coming from a fact that if we have geographical locations and if we have a cyclone, we can quickly identify who are the people who are in need of social protection, targeted social protection, or occasion-based social protection because the circumstances have called for it, right? Or if we know the age of our citizens, then we're able to kind of automatically give them pension benefits when they cross a certain age limit. So there is a lot of automation, there's a lot of targeted identification that can happen when the underlying registries, as the mayor calls them, are digitized, and we can kind of apply filters, do rule-based AI to kind of surface new beneficiaries as and when situations warrant. And that's also the kind of, how do I say, story arc that social protection delivery is following in India. So a lot of this is now based on citizen registries. Those citizen registries are basically data registries for the kind of different departments to dip into at the back end. But at the front end, the citizen is enrolling themselves just once. So I'm no longer enrolling myself for a minority benefit, for a woman benefit, for a widow benefit, for a pension benefit. But the system takes all my information at once, and then hoping that the system works well, is able to identify the several suite of benefits that I'm eligible for and give them to me. So what experts and bureaucrats the field call, this is a movement from like, this is a movement to rights-based social protection delivery, where the system knows your profile and is able to identify what you're eligible for and proactively give you that kind of a benefit. And we call them social protection open digital ecosystems. Sorry, we tried a lot of permutation combinations. This is the leanest, cleanest we could come up with. But really what we mean by that is these are open digital ecosystems created for delivery of social protection. What makes them open is not just the open nature of data sharing in a technical sense, but also open to private participation. I think some of this is like content for another conversation, so I'll just stop here, but give you a teaser. There are a bunch of social protection open digital ecosystems getting created both at the state level and at the national level. At the national level, we have the migrant registry, we have the informal labor registry, we have other registries. At the state level, we have Jan Aadhar Yojana in Rajasthan, Antyodaya Saral at Haryana. These are first among equals in that they have been around for a while some are more younger. For instance, the state family database in Tamil Nadu, or even the one in Karnataka and Kerala, right? So all these states are basically now creating their own registries, which would anchor their entire social protection delivery pipelines on the lines that I just described a while ago. And while all of that is happening, and okay, fine, I didn't realize I had this slide, but really what would a social protection open digital ecosystem look like is all of these 6 steps are really digitized. So you have an identification and enrollment where I, as a citizen, am going and sharing my data. And again, it's a one-time sharing of data. I'm not sharing it with multiple departments where I think I may be eligible for a scheme. I share it to the one centralized registry, and then that registry parses out my profile to say I'm eligible for 10 or 12 benefits. And then that's what the coordination and the orchestration process does, that all the departments of the government, let's say we're talking of government of Haryana, then all the departments of the government are looking into that profile to say, is this a person I need to kind of cater to through my department? Do they meet some target or criteria for my benefit delivery, or is it not something who's in my purview? And then once the kind of benefits have been identified, there's payments. Payments are mostly DBT, which is to say that from the government's account to the person's account. But we know as financial inclusion people in India that it's not just a matter of getting money into your account, but getting that money into your hand is another kind of leg of transaction, which is where you have in-person people, which is the fourth process, where delivery of cash benefits and ancillary services. We usually have a banking correspondent or a micro ATM or an APS-enabled service provider who helps us kind of bring that money from the bank account to the real last file citizen. In some cases, it may not be a DBT, but it may be a product provisioning, the most basic example being that of PDS. So where the person is not really eligible for any money, but they're eligible for real food grain. So that banking correspondent is then kind of replaced by a product provisioner, for instance, a PDS or a fair price shop. And then the last one is grievance redress, which actually, if done well in our understanding, is something that is a universal process which applies to all stages, and a grievance redress kind of function accompanies each stage so that if the person has any grievances, they can reach out. So that's just the digital social protection. What laying out these 6 kind of processes tells us is at each step, there is data usage by the government. Equally, there is data generation by the government. And much of this data is likely to be highly sensitive, personally identifiable. And it just paints out the extent of data intensity, for the lack of a better word, of government operations going on. And how do we reconcile the two? How do we reconcile the citizens' unwillingness to share data, or the citizens' hesitation to share data, with government's expanding use of data, right? I don't think that the answer is that the governments should stop collecting data, because that's oversimplifying the problem. That's also dismissing the kind of plethora of benefits that come with the use of data, the kind that Aparna just showed us a while back, that we can learn so much, there are insights to be drawn, and you can really go under the hood and unpack issues. But really it comes down to that, given the hesitation that people have, given the extremely sensitive nature of data that is being collected and generated by governments, we need adequate and proportionate safeguards, right? So the idea is not to not collect data. The idea is to collect data while still being able to uphold citizens' privacy and citizens' trust in the government's operations. And how do we do that? So in our work, we say that we need to design citizen-centric SPOTEs. And we're coming from a place where, like I said, we're looking at all causes of exclusion, and misuse of personal data is just one. So what our framing tells us is that if you have to be citizen-centric, you have to be inclusive, responsible, efficient, and accountable. Some of these definitions slightly bespoke, so I'm just going to kind of double down here. By inclusive, we mean that any digital social protection architecture needs to be, by design, available, accessible, approachable for the most marginalized customer, a citizen, right? So we can't say that we have a smartphone only app when we know that my intended beneficiary is probably not even a mobile phone user, right? So we have to think of the most marginalized profile and design for them, with the understanding that if you're able to serve the most marginalized well, then we're obviously able to serve those who are slightly better off better, right? So we design for the most marginalized, and that's inclusive. The responsible attribute is the one that is of interest for today's conversation, to say, how do we use people's personal data? And I think we kind of call out 3 characteristics of using people's personal data. That personal data should be used in a way that upholds people's privacy. This kind of goes back to how Ameya defined privacy for us via the 4-part test of Puttaswamy. So we uphold that right that the Supreme Court has recognized. We preserve your autonomy, which kind of speaks to the whole AI-based applications that are being used in social protection. I'll come to them in a while. And uphold the trust of people in the government, because unless that minimum currency of trust exists, it's very hard for governments to actually go out and get data to begin with, right? So that's really how we think of data protection in the context of digital architecture created for social protection delivery. There are two other attributes of citizen-centric SPODEs. I'll just complete them for the sake of completeness. The third one is to say efficient. A lot of time we see that digital infrastructure for social protection is designed to be efficient for the government. We turn it on its head to say it should also be efficient for the citizen, right? It's not that the government's kind of gaining money or saving money and, your wrongful inclusion is going down. It's also that your wrongful exclusion should go down. It's also that it should be easy for the citizen to navigate. They should not be breaking their heads to say what the next step is. So that's our idea of efficiency. And then the last one is accountability. And I think that's just a learning of the last 10 years of digital public infrastructure in India, that the system sometimes can become very overwhelming for the last mile citizen. They can get intimidated, they can get disenfranchised, they can get disempowered. And therefore the system by design needs to be in a position where it is voluntarily able to hold itself accountable to the last mile beneficiary and to the citizens at large. So that's SPODE, but again, to kind of double down that today, we're just looking at the attribute of responsible to say, how does a citizen-centric social protection digital infrastructure deal with people's personal data? So I'm just going to stop at this one. I know that there is a session later on safeguards, so I'm going to save the other 2 slides for that one. But really, what does all of that mean? What are the 3 kind of tangents of responsibility to say upholding privacy, maintaining trust, and maintaining autonomy boil down to in like English, right? And I think this is what it means, that there are 9 principles that can help either create customer or citizen-centric data protection practices. Over the years, we've realized that there's a very little difference between what good data protection practices look like for a citizen versus a customer. And these are the 9 principles that we have found to hold true for both. This work has just been published in partnership with the Security Council of India last week. The first one is for the government to know the kind of personal data they have, maintain its inventory, and ensure visibility over personal data, right? This is especially true of legacy systems, which may have been oblivious to the collection of personal data. So immediately on hand, governments may not even know the kind of personal data that they're collecting across departments. And knowing that is perhaps the first step. The second step is that when we're collecting data as governments, we need to communicate very effectively with citizens via comprehensible notices, right? Most of our government enterprises currently are kind of guilty of not having, let's say, notices, right? So for instance, the courts have to kind of call upon apps to say, no, we need a privacy policy. So that should be a given, and that privacy policy should be comprehensive and designed for the citizen and not for a lawyer, right? So that's the kind of benchmark or the standard we're holding it to. Then the third is that the data collection should be consensual, and the consent artifact should be as lucid as possible, as user-friendly as possible, so on and so forth. We can discuss this later. The fourth one is what Ameya kind of brought out in the Puttaswamy test as well, to say that all data collected is proportionate, which is to say it is least intrusive and in some aspect necessary. Otherwise, the job would not get done. So that's the idea of proportionality that we kind of anchor in. And it should also be accurate, because past experience tells us that inaccurate data is one of the biggest causes of exclusion in data-led social protection delivery. So that's the fourth principle. The fifth principle is then that once you have consensually collected proportionate data, it's your obligation to kind of keep that data secure, which is also one of the 5, or actually more than one of the 5 safes that Aparna spoke about, that once you have it, you've got to keep it safe. Then sixth is using or disclosing personal data with consent of the citizen for clear, specific, and lawful purposes. I just want to belabor this one a little bit. So as more and more digital architecture get created for social protection delivery, there's also an expanding room for private players, right? So one small example, for instance, is that when we had the COVID vaccination journey going on, and when we had the COVID app, a lot of private players, I want to say Make My Trip or Paytm, were actually offering the service of being able to book a vaccination slot for ourselves, right? Now, and that's only going to increase, and I think that's for the better. But what happens then is that citizens have shared personal data with the government under a state-citizen contract setting, right? Their expectations of the state are quite different from their expectations of financial service provider versus maybe an Ola or other digital service providers, right? And therefore, when we are sharing the same database with other providers, fresh consent as well as additional access rights, and I think Ameya will be able to speak more to this than I will, to kind of say that we give them a very excised portion of access to data so that we're not breaching the citizen state trust, which was implicit when people kind of shared data, right? So we have to understand that people distinguish between different counterparties, and that distinction is, or that distinction in expectation of privacy is maintained even as more and more people are able to kind of tap into the underlying registry. And how we do it is quite interesting, and I think a thesis of its own. Some of our future work will kind of touch on that, but for now, just going to leave it here that consent is not universal. It is very contextual. It is tied to the counterparty. It is tied to the purpose. And when either of that changes, it kind of warrants that we go back to the citizen to ask and check for their comfort. That's 6. 7th is also quite important in the social protection context, which is to say that we must enable citizens to access and rectify their own personal data, right? Because many a times it's after the fact that people get to know that their payment did not come through because the names did not match or something. So can citizens on the hand have access to their data, contest the correctness of that data, get it corrected if need be, and then there should be underlying protocols to say once the citizen has corrected it at one port of call, then it is automatically recalibrated throughout the system, right? So I think number 7 is also quite important, especially when it comes to personal data and social protection delivery. 8th is using automated means of processing responsibly. If I had to unpack responsibly, I would need another 1 hour, but really what I'm trying to say is that wherever we are using algorithms, we need to make sure that they're fit for purpose, they've been debiased, they work well, they're audited frequently, and their outcomes are audited to kind of double check on bias, right? And demonstrating compliance with best data protection practices. This is just an ongoing hygiene for both the governments and the private sector. So a lot of our work actually on the SPOD side of things, if I can say so myself, excuse me, what it does is it translates each of these principles into a checklist. So what would it mean for an SPODE to segregate data? What would it mean for an SPODE to have good consent? And we have checklists created to say, does the government have a privacy policy? Is the privacy policy available in vernacular language? Is the privacy policy available in Braille? So we have brought it down to that granular level, as Ameya calls them, to operationalize these 9 principles across the life cycle of data in an SPODE, which is some of the stuff that I'll talk about in the safeguards section. But really, that's the core kind of contribution of the work that we've done to say that we have thought about these principles, but also thought about how they are brought to life in the context of delivery of social protection through digital systems. And hopefully then governments find these checklists useful to say that if I have to start thinking about data protection, what is the first kind of basic hygiene check that I need? And perhaps this checklist then comes in friendly, but I'm going to stop here and over to Ameya.
Thanks, Beni. So actually, you might want to keep your slides up because I'm going to flip the order and send the first question to you. Originally, we had discussed doing sort of 2 rounds of questions, but looking at the time, I'm going to smush these 2 into 1, as it were. And so the more research that even Vrinda and I do in this space, right, the more we realize that there is a reasonably clear and uncontroversial understanding of legal basis, right? I mean, there are probably like edge cases where this is debatable, but by and large, it's clear. There are reasonably clear understandings of legitimate purpose, especially in the context we're talking about, which is, government and service delivery in various forms, because there are mandates. Generally, an agency has been set up to do a particular thing or set of things. Again, there can be scope creep, but by and large, these things are straightforward, right? Even proportionality to some extent is understood and operationalized, right? I mean, people might have different opinions about whether a particular piece of data is necessary or not. And like in turn, we might have our own judgments of how valid or not that claim is. But at least that conversation is possible. At least you can really get into that conversation around, no, convince me that this is necessary, and then we'll do something about it, right? The safeguards piece, we think, is still relatively untouched, right? And it goes beyond, if I keep my eGov hat on, the question is, what safeguards can you build into the platform? And I touched on some of those in terms of, API mediated access, role-based access control, logs, etc. That's all well and good. I can create a log. Somebody has to read that log and use it to do stuff, right? And so really the question I'll throw to both of y'all, Beni and then Aparna, is if we took this seriously, if we took safeguards seriously, what would that look like? Are there examples that you want to share with us? I mean, I think the checklist work that you're doing is extremely helpful for exactly that reason. But this is your chance to go into more detail. Make this a little more concrete for us.
Yeah, no, thanks, Ameya. I think safeguards would actually, even if we understand legal basis, even if we understand proportionality, safeguards would actually start from that. Because sometimes what happens is that the legal basis is very clear to the administration, but not so clear to the citizen, right? And I think that transparency is one of the most important safeguards, if I can say so myself, right? So what that would mean, for instance, is that there is a law out there which is saying that this registry would be created for XYZ purposes. The purposes may not be defined very granularly, but they should still be defined narrowly enough to know what are the broad themes. Because I think if the experience of last 10 years has taught us anything, it is that expansion of purpose, right? And it's not just idiosyncratic or bespoke to India, but data protection practices across the world tell us that purposes need to be pre-specified and they need to be limited. So I think just having that out clearly is a huge win, is also a place where many of our institutions are currently lacking, right? So just kind of having a law which sets out the purpose very clearly is the first safeguard, if you would ask me. And once you, and that's also kind of a very important tool internally, right? Because that then sets the tone of everything that is to follow, right? Once we have that, then we internally start thinking about the systems, that who is going to collect this data? Is that personnel really trained in data collection? How are we making sure that data quality is in place? How do we make sure that perpetually there is data quality in place, so on and so forth, right? I don't want to go into the checklist, but to your point, what does good look like? What good looks like is having a law in place, is having consent in place, consent which is meaningful, modular, relevant, timely. Then once all of that is in place, developing capacity at the end of the personnel, right? So that they are able to, I mean, collection of data is no mean job, right? But it is quite often the last thing we think about. And then we hire third parties to say, get into data collection. But really, who are the people? What is their incentive structure? Are they trained? Are there SOPs in place for them to follow, right? So it comes down to that, because it's not the government that may leak the data. It's these weaker links. You're only as strong as your weaker links. So I think then down the chain, you have to start worrying about, like Aparna said, both the person aspect as well as the organizational aspect. But again, if I had to call out, I would think about the whole process. And I would think about what could go wrong at each step of the process, and then bake in safeguards. So at the stage of collection, at the stage of storage, at the stage of using AI, so on and so forth.
Great, thanks so much. Aparna, same question to you.
Yeah, I think adding to what Beni said, and also reinforcing what I discussed when I was talking about the 5 Safes framework, they interact a fair bit. So you start with, what is the ultimate use of the data? It has to work for the people who are paying for the data collection and who are ultimately benefited from the services. It has to work for the people delivering the services, right? And so keeping that front and center is often the right place to start. And then a combination of these measures, we've seen data policies being developed at the state level, and that's important because while there is the Aadhaar Act and there is the National NDSAP, which governs a little bit on data accessibility, and the Personal Data Protection Bill is being reviewed and debated. That even when it's passed, that legislation provides the broad guiding principles. Then at the ministry level, at the department level, we need very specific guidelines on creating a negative list, for instance. What will you not share ever with anybody? And then for the rest, what can be shared, there need to be multiple, like almost like a matrix, right? Saying under what conditions can you share it, with whom, and how will this be shared? So that's the level of granularity that we need to start seeing in the policies and guidelines. To an extent, the Tamil Nadu data policy and the Punjab data policy talk about this. There are efforts to do metadata documentation. A lot of the citizen registry work that Beni talked about starts off with actually identifying, what data is being collected and who is the owner of that data, essentially, and then you get into it. Consent for historic data, of course, is complicated, but I think we do need to think about, if not consent at the point of collection, consent for who gets to see the data, who it is being shared with. So there are, I think, mechanisms to be able to at least inform citizens on what is happening with the data being collected. And so what should ideally happen is, I think, a couple of things. There are these, whether you call them a chief data officer or a chief impact officer within governments, whose role it is to think about, put in place systems and processes for data collection, data security, storage, and sharing, which is distinct from the technology eGov roles, right? I think that is developing, but having an additional role that does it. In some ways, the way the Aadhaar project worked out, right? It was a lot of effort on the legal, technical, and institutional on how the process was conceived and then ultimately executed, stress tested in courts, and it has stood the test of time, and it needs to work at the scale of 1 billion. So that is, I think, those policies with very detailed guidelines at the department level, positions that are created or that are merged into existing positions that talk about data issues and provide grievance redressal for the same. So while we have outbound calls, for example, for services, we should also have, while we have incoming, we should also have outbound calls that check on, do you know, or do you have access to the following? Do you know what happens on X and Y, things like that. And then, of course, this sort of, grouping of users and the safe people, safe settings interplays when you say within governments, within departments, who has access, defining those rules very clearly, having the infrastructure for sharing. Is there a single portal? Do people use APIs to draw on data? What is the data security there? So there, I think, which is not my expertise, but really a lot of what you've been doing at eGov is thinking through the tech features and the backend work that enable safe access. So it's all of these three pieces at least that have to be in place, and we're seeing parts of it, I think, emerge in different areas, and which is where ultimately, I think, as we have more and more use cases, more and more instances of using data for good, the individual parts will also develop. And it depends a bit on data capacity across the country, which varies quite a bit by state and ministry and department.
Great, thanks so much. I think I'm going to add a couple of things of my own to that list. In the meantime, let me invite the participants to put any questions you have into the Q&A tab. I think I see a couple already that are probably directed to Aparna. You might want to pick them up. I have a thought on one of them as well, but I'll save that for later. So the two other things, I think, what we've come across in our work as good practices, and it's interesting because these are the kind of things that seem to be good across stakeholders, which is to say it's a good thing for the administrator, it's a good thing for the frontline agency, it's a good thing for the individual citizen or resident. Even in the scenario that Beni was describing of private sector players coming in to do some of the actual work, it's actually probably a good thing for them as well, because, at the end of the day, if I'm a private sector player and a bunch of data finds its way to me, there is a risk and a liability that comes with that as well, right? It's not just that I have this treasure trove of data to do with as I will. There are consequences down the line, or potential consequences down the line, that I have to take into account. And so the two things I will add are, one is we strongly advise what we call federated data storage, right? So part of what worries me a little bit when I look at like the proliferation of SVODs or similar databases is that these, in many cases, these are being envisioned as like giant centralized databases, right? Which is, like in the cybersecurity world, that's an invitation for somebody to come target you, right? And so we strongly advise that whatever the agency is that has the mandate to be delivering a particular kind of service and to be collecting data that is necessary for delivering that service, right? That there is a lot that is happening on the back end, on the orchestration side, to make sure that that data is being collated into a single registry. But the actual entry and updating is happening with the different line agencies, right? And part of the reason why this is good for the government is just because, can you imagine the amount of work that the administrator of that one centralized database has to do if they have to make sure that all of these attributes about all of these people are being updated periodically, versus somebody who in any case has the job to go update this once a year, right? Or somebody who in any case is going to get an updated input because the person is going to approach them, right? So we think this is one of those things where like there is a clear win-win-win to be had for all of the stakeholders by federating. The second point that I will make is that, together with the proliferation of in-general data systems and digitalization is also a proliferation in dashboards and MISs, right? And so another principle that we recommend across the board is just separate your PII from the analytics, right? Just very much at the level of architecture, have your analytics being run on data that has already been scrubbed of PII. It is extremely rare that there is a need for individual information at that level of analysis or at that level of representation. And in fact, I think Aparna alluded to this, there are statistical techniques that you can use to introduce noise if it really comes down to the case that there's literally just one household in an area or something, right? So these are two practices that we think are pragmatic and useful, and which even in the scenario that there is private visibility to some of that data will actually work to reduce the amount of risk or liability involved in that. With that, Aparna, do you want to answer on, or I see you've typed in some stuff. But...
Yes, I think it should, I can answer it on chat.
Great. We also have, I think we have a question from Ankit Saxena as well. If anyone has in fact worked around Google Sheets, if either of you all want to pick this up on the chat as well, on mic as well. And I know the question directly says like safeguards around Google Sheets, but please feel free to take it a little broader. If there's either other tools or systems you recommend or best practices around Google Sheets.
Yeah, I think Google Sheets, not great for personal data. I mean, it's a great collaborating source, but if it has confidential or, of course, not confidential information for sure, but personal information that is not available publicly, then it's very hard to encrypt it. There are a number of other encryption solutions on things like VeraCrypt and other sort of solutions, which can let you protect the CSVs and the files that you're working on, and then share them with password protected containers. So there are a number of other methods that are available. The best way is, as what Amaya was just explaining, is often you almost never need personal information for analysis. So it's best as if you're working with Google Sheets is to not have the personal information columns, the names, numbers. You can just strip them of that data, and then it's okay to work on Google Sheets. Okay. Hope that answers it. But there are a number of resources. The handbook on administrative data, which I mentioned, and I'll type a link as well, talks about a lot of these mechanisms that are available statistically.
Great, thanks so much, Aparna. I had one response also on the question around like, if your data set has bias, what do you do in that scenario, right? And again, we'll pause a minute if anybody else has questions to type in the meantime. If not, then I will hand the mic back to you all for sort of 2-minute closing statements after this. I think implicit in that question and what like making explicit and checking is who is the you in that question, right? So if we imagine that there is a scheme that is supposed to deliver this particular benefit or set of services to that target population, then the fact is that okay, let me expand this slightly and also make this my last remark for the webinar, right? The straightforward thing is that there has to be some way of identifying that target population. And so there is going to be either some data set or some set of operations and derivations from that data set that will enable identifying this target population. Assuming that the government entity that is responsible for delivering this service is conscientious and serious about doing their work, they are going to try to pull together that kind of data from somewhere, right? And so I think in some sense, the existence or not of a particular data set with some sort of known issues can be a challenge or an issue at a particular point of time, but in the lifetime of that scheme is likely to get addressed. That was my straightforward answer. The more provocative and hopefully interesting idea is that, just as I said, I think safeguards are still sort of being understood better. Proportionality and data minimization can potentially be understood and explored a lot better, right? By which I mean, we've collectively right now in this conversation taken it as a given that certain amount of information is necessary because targeted delivery is necessary, right? But if I take off my eGov hat for a second and I put on my like back in grad school DevEcon public policy hat, the cost benefits of targeting are also a subject of debate. And it's interesting to me that having left those classes behind almost 7 or 8 years ago, now the data minimization conversation is sort of leading me back to this question of, if I aim for radical minimization, which programs would I say are opt-in, non-targeted, not means tested? And, how would we study the actual efficiencies and benefits around something like that? Versus ones where we think, no, there is actually a very strong rationale for targeting and hence a rationale for collecting the kind of information that's necessary for targeting. Let me stop there. I mean, no, I'm tossing that out as a provocation. I don't have an answer on that one at all. But yeah, let me pause there.
Yeah, so if I can just piggyback on that, completely agree. Like, I think it is tempting to think that more data is better and more granularity is better. And in many cases it might be, but we must kind of regularly kind of reflect on what is the kind of comparative advantage of getting that layer of granularity versus what is the cost that I'm exposing the citizen or the system to. And I think it's going to be an iterative, constantly re-evaluative kind of a negotiation between the two aspects. So completely with you on that, Ameya. I think just in terms of my closing remarks is there's something that I found myself saying very recently, actually just last week on another panel, and that articulation has kind of stuck with me, is that to say that oftentimes we're kind of designing for what is possible with the level of technology, what is the state of the art, as opposed to what is the risk appetite of the system, right? So perhaps we also need to kind of think about that certain things may be possible with tech, but really what is the downside of that should that tech misfire? And I think that at some point, designing for the future is always great, but we need to kind of sandbox a lot, we need to pilot a lot, we need to iterate a lot to kind of come to a place where we're comfortable saying that, tech can make decisions as enduring and as kind of grave as who gets entitlements when what. And this is just in response to the biased algorithm question, that if you suspect your algorithm to be biased, and if the question is really who gets put on the PDS list, the short answer is rework on your algorithm, go back to the drawing board, etc., etc. Don't come back until you're comfortable, right? And just in terms of saying that it's a great place to be at right now, because we know privacy is important. We know that stakeholders across the board worry about privacy, starting with like governments to even private players. Gone are the days where, like you said, data was seen as a treasure trove. People see it as a liability. They want to make sure what they have is good and that they do right by it, etc. So I think that it's a great time to be alive in that sense. But what we really need to kind of do is bring the citizen story at the center as well, because right now the conversation tends to be very technical, whereas a lot of that technology can actually really benefit from the intuition that the citizen brings to the table, right? So how do we kind of marry the two sides is what is interesting to us. How do we kind of study the not so visible feedback? And this kind of takes me back to a conversation we had last year, Ameya, feedback loop 1, 2, 3. I didn't even know a third one existed. You kind of taught me that. But really, the implicit hidden feedback in terms of, exclusion outcomes, in terms of the number of attempts that it's taking for people to get their data corrected, in terms of, data breaches, we need to be like learning, we need to be absorbing all of that and then baking it into the system as rapidly as we're rolling out the systems, because really all of this is right now one big live experiment. And if our feedback is not agile enough, then we could be in trouble, right? So I think that to say, it's great we're not having that debate that privacy is important. It's great that we're having that debate that privacy is important, data protection is important. How do we get there? And one important way to get there is to be very aware and vigilant of what we're seeing around us and mitigating it in, kind of subsequent iterations.
Great. Thanks so much, Beni. Aparna?
Yeah, I think I would make the case for a slightly higher level thinking on use of data and evidence in the policy life cycle as a whole. So, a lot of decisions get made based on ideology, based on the fact that we don't really need to change status quo right now, or because we don't know what's better. So embedding this culture of constant innovation and learning from doing at the policy level will also translate into how we think about data and how we learn to set up systems and make them better, right? So anchoring it to improving welfare or maximizing impact of the resources that the government spends will necessarily mean that we try to constantly experiment and find the best ways. This means that you adopt and integrate research systematically and institutionally, rather than one-off efforts between interested say bureaucrats and interested researchers, but build in a mechanism for research and policy to talk. And what research helps do, while it takes a longer time, and there's a bit of tension with policy windows, what it does help is it solves for the long term, it solves for scale, and it solves without an agenda. Right? We're all aligned to the question on improving welfare, and so it, by definition, it builds in a lot of learning and it builds in a lot of testing, which is what you need, especially when we have to come up with systems that stick. And so I think building that mindset of research, not just by external researchers, but within governments, helps bring about that mindset change to start with. then that gets supported with the systems and technology that can enable that environment, as well as the human capacity and the financial resources that are needed for people to innovate and to learn and to essentially link the learnings to the planning cycle, so that budgets are made based on evidence, based on data that is being collected. Otherwise, we have a long history of data collection. The question is, what are we collecting this data for, and who benefits from it ultimately? And so I think using that evidence-informed approach to decision-making can help solve ultimately for the questions we're talking about with data today.
Okay, thanks so much. The last thing you said reminded me of something that a colleague also recently brought up, because he was speaking on a panel on data for development and like flipped that to say whose data for whose development. And you're right, it's worth having that specified and thought through. Great, thanks Beni, thanks Aparna. We're pretty much at the close of the webinar. I'm going to invite in Brinda for the last word and for closing us out.
Hey everyone, thank you so very much for being a part of this really great session that we had. Amay and I have been constantly reading, researching, discussing between us on, administrative data and the safeguards. And it's beautiful that, Dwara and Jaypal has done such, in detail research about it. And today there's a lot that we take back home, but more than anything, I think we take back the fact that administrative data requires data privacy and protection safeguards. And that's something that we should take back to all the people out there, that just because it's data that's available already doesn't mean that it doesn't have to be always openly insecure and like not being safe. But nonetheless, thank you so very much for being a part of this webinar, and more to go. Definitely learning more from you all. Thank you so much.